Hey everyone, Erica Becker, your host of the GC360 podcast, where we talk about pretty much everything and we have some of the most interesting guests in Garden City. And today I'm really excited for this episode because we're going to be talking about mental health, and it's very important and prevalent right now. So we are really, really lucky to have on the show today Kenald Bernard. He's a licensed therapist and he's also a published author, which is really cool. So Kenald, thank you so much for being on the show today and taking time out of your day to come.
Thank you, Erica, for having me here today.
Yeah, we're really excited. So to start off, let's get right into how did you get into therapy? What made you want to become a therapist?
Well, getting into therapy, I wouldn't say I fell into it by accident, but it happened organically. So when it comes to like being a young man, we always like hang out in groups and things of that nature. So it's very popular that they talk about, hanging out at the barbershop and talking with each other. So we used to hang out, whether it's someone's steps, the barbershop, the park, things of that nature. And I've always been the type of person who would be facilitating conversations in those environments, helping people kind of extract ideas from them. And a lot of my friends, you say, man, that was an interesting question. Like, why would you ask me that? Because I would ask a lot of open-ended questions because I always wanted to know more about whether it was a person or, a topic. So, when I was in school, especially in college, the college that I went to, they had a lot of teaching and like human studies, and I kind of fell into the field and pathway of sociology and anthropology. And from there, there's a few different directions you could go after that. You could do research, or you could go into some clinical work, or some macro level administrative stuff where you're kind of dealing with social services. So I dabbed into the social services, and then I made a sharp right into the clinical field. And I liked it because it was an avenue where I could get more one-on-one with clients, rather than dealing with an entire community. So, you could kind of center yourself and be more impactful and see it.
So one-on-one versus an entire community, what does that look like whenever you're working not one-on-one with a whole community? Are you doing like group therapy? Is that what that means? Or?
It would mostly deal with working on pretty much like if you're working like on policies, you're working on investigative aspects. One field that I have in my background is working with child protection. So, I was one of the people working inside where you had to investigate abuse or neglect from parents. You're dealing with the court aspect, placing the children out, in a different home, if abuse and neglect is found there. But, when it comes to like what happens after that, that wasn't my role before. And I always wonder, like, what happens after that? How can we help restructure? Just because a parent abused and neglected their child, it may be a repairable situation with some, rehab, some services. And that's where I began to dive deeper into working with outpatient services, one-on-one group. Group would be more closer and intimate than, dealing with other stakeholders where it might be an agency. So we have one-on-ones, family, couples. So I was beginning to dive into that realm.
Okay, cool. So give me a sense of the timeline then. You got into therapy, you told me, over a decade ago, right? So how long were you doing the work that was before you got into the more intimate one-on-one?
2007.
Oh, wow.
Yeah, so let's try to do this quick math. So, you're right, so it's almost 16 years.
Nice.
Right? So, so I started off working in a runaway shelter that's based out in in Times Square area. I didn't even know that they had that close.
Neither did I.
But it's for ages of 16 to 21 teens, and they were running away from all sorts of places, outside of New York as well, and coming here. And we would help them if they wanted to reunify. We would help them reunify with their family. And if they wanted to work on a long-term independent living, is what they called it, we would help them attain their own apartment, get a job, finish school, things of that nature. From there, I went into working into child protection as a frontline child protective CPS worker, child protective specialist. I did that for about 4 years. That's when I graduated and became more clinical. And then I transferred to the Department of Health, where I worked with the population, the forensic population. Fancy way to say people who are incarcerated, right?
Yeah.
In jail, in prison. And I was working in the jail. We were practicing DBT, dialectical behavioral therapy, also known as mindful therapy. And it was supposed to be a very effective approach for people who struggled with just poor patterns of behaviors that led them into jail. And it was supposed to help reduce recidivism. It was very rewarding seeing people actually get released and stayed out of trouble. So I did that for a couple of years. I told my mother and father that, they said they never want me to go to jail, but like I made it to jail, but at least I got
for good.
Yeah, I did a couple years, but it wasn't because punitive. I worked there. And then from there, that's when I dived deeper into clinical social work, where I was providing that psychotherapy to individuals, families, couples.
So you mentioned about behavioral patterns and helping people to change those. I had a guest last week where we spoke about the patterns of the brain and how you can kind of retrain it. Do you think that you can, with certain things, certain practices, retrain your brain to have different patterns? Because, there are some people who say after someone's 25, they'll never change.
Yeah.
What do you think about that?
Yeah. I think that it's true. Some people will not change. Because the irony of it is it's up to that person's willingness to change. So it's not that they can't, it's just are they willing to? And oftentimes when we're in this comfortable space, it's not that it's the appropriate space or positive space, but if we're just comfortable in holding this characteristic, we're not willing to let it go, to explore this other side of ourselves. So, when sometimes oftentimes I have like discussions with older people in senior years, and they're like, well, I'm this age and this is how I've been and I'm not changing for anything. And I totally understand them, and it's about that. There's this buzzword that's been floating around, vulnerability. So if I'm going to change, I have to be willing to be vulnerable. And some people struggle with that, as they should, because we associate vulnerability with weakness, but it's not. It's just stepping out of our comfort zone, our homeostasis. And people can change if they want to. That's how I look at it.
I like that. People can change if they want to. All right. I have so many more questions for you, and I'm excited to get into it. We're going to take a quick commercial break, and we'll be right back after these messages.
My father never stops moving, but after he had a brain aneurysm, he had a difficult time getting back to his normal routine. That's when I called Alliance Services. They paired him with Rosa. She developed a custom home care plan that helped him with his recovery.
Rosa helped me gain my independence back.
Alliance Services, helping older adults continue to live well and independent.
Hey everyone, we're back on the GC 360 podcast. I'm Erica, and if you have just joined us, I'm here with Kenald Bernard. He's a licensed therapist, and he's also a published author, which I want to talk about that too. So we've been having a really good conversation so far about therapy and mental health and how the brain works, and also your background, which is very interesting. You've been doing this for a long time.
Mm-hmm.
So it sounds like you've worked a lot with youth. Would you say that's true more so, or do you work kind of with a range of age groups?
Nowadays, I would say that I work with a range, but I do have a lot of experience working with youth. Many youth that I work with were, and this is after the child protection piece, were youth that struggled with ADHD, youth that struggled with oppositional defiance, and the youth that had, some form of trauma. Many times the youth that I work with, they were referred by their parents. And for many of the population or clients that I get a lot of African American males. And the parents often bring them because they feel they hit a wall of communication. They could tell that there's something going on with their child, but they won't open up to them. So let me have a neutral person to kind of, unpack with them. And in the Black community, there's not too many people who go to therapy. There's still that stigma that's attached to therapy.
There is. Okay, I was going to say, why do you think that? So there's still a stigma?
Going back to the vulnerability, some people view mental health as a weakness. If I have to seek help, that means that I'm weak. That's part of the stigma. And even when it comes to the expectation, some people believe that their problem is not that serious to need any counseling. So they minimize it. In addition to the more equitable issue of the affordability of therapy. We don't understand the dynamics of the cost until we need it, and then the provider says, well, the cost is going to be $150, $250, or we don't take this insurance, and then it becomes a financial issue versus a mental issue. So those are some issues that people face, especially in the Black community around it.
Yeah. What do you think about generational trauma?
Yeah, we could pass down trauma like a recipe, and that, even when it comes to physical health, some doctors would tell you that, yes, the blood pressure runs in your family, diabetes runs in your family, but are you also looking at what you're eating? So now I'm looking at how did my grandfather process his struggles? What did he hand down to my father, who then handed down to me? So that's how that generational trauma gets passed down. And there's also that vicarious trauma where it's someone else is going through it, but because they're unpacking it to me, I feel like I'm going through it. But it is a real thing. And that's where we want to kind of break some of those quote unquote generational curses. And when we put in our self-work, and seeing a therapist or doing whatever it takes to make some quality of life changes to kind of pour in some positivity into our family and generations to go.
Yeah, I think that's really interesting. And speaking on that, I know that you said you have 3 children.
4.
4 children.
3 girls.
3 girls.
Yeah,
wow.
Yeah.
So I know that they're young, right?
Yeah.
Yeah,
I have
young.
a 2-year-old and I have a 14-year-old. Yeah.
Okay, I mean that makes sense. 4 kids, yeah. My siblings and I are 11 years apart too. So, are you doing anything as a father, but also with your knowledge about all of this mental health information that you have? Are you doing anything specific with them to help them to maybe not have some of the trauma that you had or that your father had, or anything like that?
Yeah, it's interesting, being a therapist and then being a parent, and you have to kind of switch between roles, even with your own family, So when it comes to my children, thankfully for my upbringing, my parents did the best they can to give me a very healthy environment, as healthy as they can make it. When it comes to my children, I'm trying this saying my dad said, I want you to use where I'm at as your baseline and be better. So I try to do that with my children. So I'm going to give them as much as I receive and better. I work a lot with them working on their emotional intelligence. So just understanding how their mood, their mind, their thoughts correlate with each other. And kind of putting the medicine in the candy, where it's like, after school, when they come home, rather than talking about just how was your day, they're just going to say good and leave it at that.
Yeah.
But, I find ways to kind of help them tell me more, and to a point where they get comfortable in speaking about their emotions. Oftentimes, they might get whiny, they might have a tantrum. Teaching them ways for them to cool down, healthy ways to cool down. If you master that now, by the time you're a teenager and adult, you're going to have this secured attachment. Attachment comes from a theory in psychology where we talk about 3 types. We have secured attachment, we have the anxious attachment and avoidant. And the secured, of course, is the more positive ones. You have those tools to kind of navigate through life, whether you face an obstacle or not. So I don't think they're going to be perfect kids, They're going to have to face the world like everybody else does. But at least at home, where they have the first image of the world, they at least see something healthy.
And all you can do as a parent is give them the tools to deal with what comes at them.
Exactly.
So what's something that you do with them? I know probably a lot of parents need help with this. Like you said, when you get home from school, how was your day? It was good or fine. How do you get them to elaborate?
So I might say, what did you do? And they would share. We made some artwork, or when it comes to what did you eat, and then we talk about, so who was sitting at the table with you, just trying to allow them to have some imagery on how things were for them in the day. They're probably not going to be willing, at least my younger ones are not willing to journal as much. But for my oldest one, I do encourage her to journal her thoughts. She's a teenager, so being comfortable in kind of writing things down, it provides us on a therapeutic level. It's like a MRI or X-ray for us, in a sense where we can't truly look at what you're thinking about. We can see what stimulates you and what part of the brain it's attracting, but we don't know what's really going on. So when we go to the doctor, we might have pain in our knee or on our leg. They have to do an X-ray, MRI to see if you have a hairline fracture, a torn ligament, things of that nature. Journaling allows you to really put the unconscious thoughts onto the paper, because you're kind of just pouring out. So, I always encourage my daughter to read back her journal as well. And we respect the privacy of a journal. Some parents, they sneak in a room and they're reading their kid's journal. So we respect the privacy of the journal as well.
Yeah. I'm a big proponent of journaling, so I'm glad you said that. And speaking about your kids too and writing, you wrote a book.
Yes, I did.
And the inspiration was your son, which is cool. So tell me about the book.
So this is a children's affirmation book. It's called KJ, He's a Reflection of Me. So KJ is Kenald Jr. So the book is there, well, the images itself were supposed to kind of give some affirmation, right? So as we talked about it earlier, the Black community doesn't truly have that many we don't have the highest statistics when it comes to participating in therapy. However, it doesn't mean that we don't partake in mental health. So the affirmations is basically an opportunity for us to build ourselves up. So he's going to see an image of a young black boy doing positive things in that book. I utilize the ABCs to give it some educational aspect, and I use the ABCs to create those affirmations as well. So it was inspired for him. I only have one boy. I was able to get that boy, and I wanted to give him something, a legacy for him to inherit and embrace. I actually read it to his school during National Read Aloud Day, and they loved it. You know?
Wow.
And although, I make mention that the main character is my son, is very diverse, where you could have all races read that book, especially for the boys. They'll love it. They truly enjoyed it at the school. And I actually asked my local library to put it into circulation as well.
That's so great. So words of affirmation, you think that that's a really helpful tool for young people?
Yes, because our self-esteem has to be built from, we're not born with it.
Right. So
how are we pouring into ourselves? Even as simple as when someone falls and it's like, get up, you're strong, and you're gonna make it. That's an affirmation within itself. But are we even identifying that that's an affirmation? So we want to be very intentional for the children to understand how to pour into themselves. Because now I'm seeing it in the back end, where many clients who are adults that are coming to me, they haven't built that self-confidence and self-esteem. And part of it is because it was absent during their early childhood.
I agree with you on that. I actually teach acting to young kids here at the studio, and I think that it's a way, a theater and acting is a way to build confidence. It's what I tell people. There's lots of ways to do it, and I think that you're right. I think you have to start young and build that up, or else you're going to be paying for it later.
Exactly. Because the affirmations has a 3 Ps concept. You have to be present, it has to be personal, and it has to be positive.
I love that. That's great. So there was something else that I noticed about you with the different techniques that you use in your therapy. One of them that stuck out to me was that you use humor therapy. So I want to know a little bit more about that, because it sounds good. It sounds great, but I've never really heard of that as a term.
Yeah. So humor therapy is pretty much an approach that we use, and it takes a lot of personality for someone to use that. So if you don't really have a funny bone, you're not going to be able to provide that approach. And for those who know me personally, they know that I have a big sense of humor. I love to laugh. And we know, how powerful laughter could be for us. So it's pretty much just incorporating some opportunities of humor to exist in a therapy session, right? This helps someone unwind, feel more comfortable. It allows them to kind of decrease some stress levels that they may be facing entering the session. So many of my young teen clients, they love it, because they enter therapy thinking it's punitive because my mom or my dad or the school referred me for therapy. But this is a safe space. It could be a fun space. It could be a serious space. But it all depends on what we want to work on.
It's great. And I know that you probably, since the pandemic, nothing has been the same as it was before, obviously. Did you really see, I know that you had to work a lot from home, you said, but did you see a rise in people needing more help with their mental health? Are people more open to coming to therapy now, do you think, since then, since that happened?
I think that is a surge. Some people call it a trend, but it's not, because I think it's here and it's here to stay when it comes to mental health. Even like doing some research, I was looking at how how the numbers have been climbing on people who are engaging in therapy. And it's doubled since 2012.
Wow.
You know,
That's big.
you know, and you know, we're becoming more aware on the importance of mental health. We are more in touch with our mood. We are more in touch with our thoughts. And now just something like this, having a podcast, allows people to share their testimonies on how they got some control over their mental health and how it has changed and impacted their life. Because our mental health has to do with us actually getting up and getting to work. Us taking care of our family. If that piece is not stable, then the other parts fall apart. So we have to make sure we tap into that. For providers, we need more providers.
Yeah, okay.
You know? I've been, for those folks who are in my field but aren't doing clinical work, if they have conversations with me, I always push them to open up around that, because there's a big need for that. And we, like, especially in the Black community now, we're looking at it that there's only 4% of the therapists are Black.
Wow.
And
that's lower than I thought it would. I didn't realize it was that low.
It's extremely low,
Yeah.
right? And for the most part, even fewer of that 4% are Black males. So now, you know, I'm getting so many referrals and requests for young Black males who are looking for looking for Black male therapists, that it becomes overwhelming, you know.
Sure.
But there is a surge there. But there's so many different platforms to find therapists now. And I even tell people, you don't have to find a therapist that looks like you. You just have to find a therapist that not only just knows what they're doing, but that works in the field that you want to work on. So if you're struggling with depression, finding a therapist that works with, you know, depression, anxiety, those are the two most common ones, depression and anxiety. So you find someone who has that specialty and take it from there.
So great. Now, before we sign off, I had one other thing I wanted to ask. Do you think that everybody needs therapy? Do you think that everybody should go?
I think everyone should experience therapy at some point of their life. I don't think that everybody needs therapy at the moment. You know, I think that when we look at mental health, I always kind of utilize the comparison of a mental health clinician and a physical trainer, right? Someone you might see in the gym training someone. You're going to see a lot of people in the gym. Not all of them have a trainer. But the ones who do have a trainer, they have specific goals, and they probably are tackling those goals. Whereas if you take a survey and ask others, have they been trained before? They say, yeah, I was trained before. And they're probably utilizing those skills and tools that they got from that trainer. So mental health is similar to that. At some point, yes, try it out, see how it is. Even if you feel that there's nothing to work on, there's always something to work on.
Yeah.
And, you know, that provider will assist you in either reinforcing your tools or learning new tools. And those are going to help you pass that on. That's how you break those generational traumas. You know, now you feel more equipped to speak to someone. You feel more equipped to, you know, raise your child, your niece, your nephews, and you become a powerful mental health ambassador in your community.
Yeah, I think that was very well said. That's very true. Kenald, this was great. I love hearing you talk about I could ask you 1,000 more questions. Probably we'd be here all day. But thank you so much for sharing all of your knowledge. You have so much to give to the community, so I'm glad that we're getting you out here. Now, first, if people want to check out the book, where can they find it? Is it on Amazon?
Yes, you can find it on Amazon. You can find it on Barnes & Nobles. The title is KJ, He's a Reflection of Me.
Cool. And then if they want to get in touch with you, how do they look you up?
You can go to my website, kbcounselingservice.com, or you can find me on Instagram at I am Kenald, Kenald.
Great. Awesome. Thank you again for being on the show. It was amazing speaking with you. And to our audience, thank you so much for tuning in to this episode of GC360. This episode was sponsored by Alliance Services, and we will see you next time.
My father never stops moving, but after he had a brain aneurysm, he had a difficult time getting back to his normal routine. That's when I called Alliance Services. They paired him with Rosa. She developed a custom home care plan that helped him with his recovery.
Rosa helped me gain my independence back.
Alliance Services, helping older adults continue to live well and independent.